Hi, I'm Katie. I'm going to be doing my newborn assessment today. So I have kind of looked at the birthing history prior to coming in, collected some supplies. I'm coming in, introducing myself to the parents or mom or whoever is in the room. I'm going to provide privacy, wash my hands, and let them know that I'm doing the newborn assessment. And if they have any questions, so please let me know. So I'm going to start with getting vital signs. We're going to be getting a pulse, temperature, and respirations for the baby. I'm going to be weighing baby, measuring length of the baby from the top of the head to the tip of the toes. I'll be measuring head circumference and the chest circumference on baby. So then I'm going to be doing kind of a general appearance. I don't notice any signs of respiratory distress, any cyanosis or anything like that, no nasal flaring, grunting, anything. The symmetry and alignment is looking good on her, and she's not crying at this time, so that's good. So I'm going to move on to looking at things on her skin. I do notice vernix, which is normal for babies. It's a white cheese-like substance all over the baby to protect the skin. And then I do not notice any milia or petechiae. The petechiae is pinpoint-like red spots. Milia is sometimes seen across the bridge of the nose or on the face, the little white calcium deposits. Lanuga, I don't notice that as well, which can be extra hair on the trunks or back like that. And then I'm going to check for Mongolian spots, which can mimic bruising and be a little bit larger, purple in color, blue in color, on the trunks or on the back of the baby. So I don't note any Mongolian spot or erythemus either, which can be baby acne, all of which sometimes can be concerning to new parents. But so after I finished my skin, I'm going to go ahead and start with my head assessment. So the anterior fontanelle, I'm going to be lightly palpating. Should be a diamond shape for anterior and triangle for posterior fontanelle. It feels flat. I don't see any edema or any bump. I know that this baby was a vaginal birth, so molding and caput or caput is noted a little bit of edema, and like I said, that's perfectly normal. And then no cephalohematoma, so no bruising or blood clot that would be noted up here on the baby's head. So I'm going to go ahead and move on to face, which again, just looking for symmetry in the face. For eyes, I'm looking at the iris color, which right now it's noted to be gray, and then I'm going to see if the eyes the pupils, are equal, round, reactive to light. So they are at this time. They're not accommodating, which is also common to not quite happen yet for newborns. I'm looking at strabiscus, which is another term for lazy eye. That's not noted right now, but is again a normal finding early, early after birth. And then looking at conjunctiva, and sclera is white and no drainage or any signs of infections pertaining to the eye. Moving on to nose, I'm looking for patency of both nostrils because babies are nose breathers. So both nostrils, I feel each side, and it is patent. They're able to breathe just fine through those nostrils. So ears, I'm looking, are they well rounded? Are they well formed? They both look the same, and they're in alignment with the eyes. So ears are good. Next, I'm moving on to the mouth. I'm going to insert my pinky with my glove on, of course, and feel the baby's palate, see if I feel any holes or anything that might indicate cleft palate. I may feel the sucking reflex at this time as well. And then I can note if I spot any Epstein pearls, which are small white calcium deposit that can be normal in a baby's mouth as well. So once I have finished that, I'm going to go ahead and palpate the baby's neck and clavicle and kind of just inspect and palpate, and that looks good and feels good and feels intact. Then I'm going to move on to chest. I'm looking at the chest for rising and falling of it, and checking the nipples and measuring them, making sure there's just the two of them, checking for any engorgement, which can happen sometimes with babies. And then I'm going to go ahead and listen to lung sounds. Once I'm done lung sounds, I'll go ahead and listen to the apical pulse for 1 full minute, and listening particularly for any murmurs. Lung sound good and pulse is good, no murmurs heard. So moving on to inspecting the abdomen, I'm going to be looking at the umbilical cord. Baby is over 12 hours, so I will not see the 2 arteries and vein, but the umbilical cord looks good, no signs of infection at this time. I'm going to be listening for bowel sounds. Baby has had some feedings, so should hear bowel sounds. And I do hear active bowel sounds at this time. Mom reports baby is having about 5 to 6 diapers daily, and has also passed their first stool, the meconium, and is pooping well. I'm going to take a look at the genitals at this time. I am working with a baby girl, so I'm going to be looking at the vagina and the labia majora, making sure that it's covering the clitoris, which it is. And at this time, since I'm here, go ahead and check for the anus patency, which it is. I got the anal wink, so that is positive there. So once I finish that, I'm just going to go ahead and look at the extremities again. I'm checking for alignment and equal on both sides. I'm checking for range of motion. I'm going to go ahead and look at the feet. I'm going to count the fingers on the hands and toes. I've got 10 fingers and I've got 10 toes. And check for hip displacement by bringing the knee up and then out. And if I hear any clicking, I would need to report that to the physician so they could further evaluate this baby. Once I've kind of looked at the extremities, I'm going to go ahead and start with my reflexes. I'm going to start with Moro. I'm going to lift the baby girl up and kind of lower her head, lower than her body, and it startled her, so that's a positive Moro. Tonic neck is if the baby's head is turned to the right, right arm would be up, left arm would be down, same as on the left. Put the baby's head to the left, left arm would be up, right arm would be down. I'll go ahead and do plantar reflex by checking to see if the baby's fingers wrap around my finger, and same with feet. Plantar, I will place my finger at the baby's feet, and toes do wrap around. So I'm going to go ahead and do Moro, which, I'm sorry, not Moro, rooting. Rooting reflex, so that is where I rub the baby's left side of the cheek and the head turns that way, same with right. Sucking and swallowing reflexes, I got to observe already or can observe again during feedings. And then stepping reflex, I'm going to hold the baby up as if they were going to be stepping, and they alternate lifting their knees up, kind of mimicking stepping. I'm also going to be checking the baby for Babinski reflex, which is where I take the finger and rub the bottom of the foot and look for the toes flaring out or spreading out. And it's a positive Babinski on both feet. And then I'm going to pick up the baby and look at the back and look for trunk incurvation. I'm going to be rubbing my finger on the left side of the spine and looking for the body to kind of curve towards the left, and then same with the right. And I noticed the positive curvature on whichever side that I rubbed. Also, while I'm back here, I'll go ahead and look at spinal alignment and check for any openings in the spine, which I do not, I don't have, there's no openings and the spine is in alignment. So after I've looked at reflexes, I think I've finished up the newborn assessment. She has been in the quiet alert most of the time, not really crying too much, which is good, the quiet alert behavioral state. And I would see if the mom or dad or whoever's in the room has any questions for me. I could take this opportunity to do some educating. If so, I go ahead and wash my hands and make sure the baby is back in the crib or with mom safely, call bell within reach, and then I would go chart the assessment that I just did. Thank you.